Many women I meet ask me about birth control. Should they go on it? Should they not go on it? What should they be thinking about? Well, I actually talked about birth control and thinking about the holistic landscape around starting birth control in this video right here. We are now going to get into some of the pros and cons of going on birth control pill. And some of them are fairly simple. We know the advantage of going on birth control is regulation of your cycles, taking down maybe painful or heavy cycles, helping with mood, which is a real thing, guys. That PMDD, where your mood just tanks the week before your cycle and then takes another 5 or 6 days to kind of come out of it, can be incredibly debilitating for women of all ages, from teenagers to even women in their 40s and early 50s. So birth control does have some pros when it comes to managing many of these symptoms. Of course, if you're using it for birth control, that's a no-brainer. Now, at the same time, there's some things to watch out for, and we did talk about it in part 1 of our birth control series, and that was mainly that when birth control is not well matched, right, to you and to your genetics and to your overall health, then we do see some of the side effects. And some of these side effects can be debilitating. This is everything from weight gain. I've had patients that suddenly gain 10 to 20 pounds the minute they start birth control, chronic headaches or migraines, breast tenderness, or a lot of spotting and bleeding throughout the month. So again, the decision to go on birth control begins with, if you truly need birth control, what form of birth control should you go on? And the answer to that question really lies around what your overall health is doing. There are many different forms of birth control, right? We've talked a lot about birth control pills. We've talked about the IUD. There's also the mini pill. And when you jump into the IUD category, there's a copper IUD, there's a non-copper IUD, there's one with progestin, one without progestin. So these are some of the questions you should be asking your doctor when you're trying to make a decision about which particular form of birth control to go on. There are many patients that come in, and I actually recommend non-hormonal forms of birth control. And there are a number of reasons, some of which we've gone over, honestly. But if a patient is having a lot of issues with the metabolism of hormones, right? So that's where your body, for different reasons, can't move estrogen through, can't move progesterone through, and is getting stored. And there is a way to test that, by the way. You can test it in lab work. You know, I get so frustrated when people say we can't test hormones, but you can test an estrone, which is a storage form of estradiol. You can also test things like a 17-hydroxyprogesterone, a pregnenolone. It gives you an idea of how much of that is actually in your body, and you can do that through a traditional LabCorp request order. And then saliva or urine testing actually will give us even a deeper picture of what your body's doing with the hormones that you have before anyone even gives you hormonally based birth control. But let's say those tests come back, or you tell us as your providers and practitioners that you know that when your cycle comes or right after your cycle, you've got the heavy breast, you feel bloated, you feel puffy, you're getting a lot of migraines. You may not be a great candidate for hormonal birth control. The lab tests that we do kind of help us support that decision. So if we see some of these numbers that I just mentioned as being particularly high, if now we go in and add a hormonal-based birth control, we're going to make your overall chemistry worse. So what we want to do instead is think about what are the non-hormonal ways of managing contraception. So this is where things like a diaphragm come into the picture and have been shown to be effective. A cervical cap is another option as well. The IUD, there is a non-hormonal IUD that you can use as well as an option. And there's also a vaginal gel that you can use right before sex. So a little bit less convenient, but it does work in terms of helping with contraception overall. So when it comes to birth control, I think what I really want all of you watching and listening, especially for our very young women and our teenage girls, is first of all, are you going on birth control for birth control? Then the second question is, if the answer to yes, hey, I need birth control, what are my options? Do you want hormonal birth control or do you want non-hormonal birth control? And the answer to that really lies in your overall health, in your genetics, and things like your gut health, your liver health, and how it's all playing into how you're feeling and functioning on a daily basis. Either option is okay. There's not a good, there's not a bad, there's not a right or wrong. But what I really, really want to stress is that I don't want young women, or honestly women of any age, balancing their hormones using birth control. We have to have a holistic approach. I talk about it in the hormone shift, that will ultimately serve each of us in the long run way better. All right, I post new videos every week. Don't forget to like and subscribe.